Everything you need to know about headaches. Every one of us has been struck by a headache at some point, but not everyone knows how to deal with it. After watching this video, you'll find out how to relieve headaches at home. We'll also talk about headaches caused by high or low blood pressure. Watch this video till the end, and if you have any questions, post them in the comments. We'll get back to you. First, let's talk about types of headaches, so you can identify them and know what measures to take. What types of headaches are there, and how do they differ? Migraine. This usually manifests as a throbbing or bursting pain that worsens with movement and physical activity. The pain is often felt on one side, and the affected person can experience nausea and intolerance to light or sounds. Migraines can last anywhere from 2 to 72 hours. Tension headache. Usually, this feels like a squeezing dull pain, as if the head is in a tight helmet. Sometimes it spreads to or from the neck. These headaches typically last for several hours, but may persist for several days. Cluster headache. This is usually intense, sharp pain in the eye area, accompanied by watery eyes and redness. You may also have a runny nose or nasal congestion on the affected side of your face. This attack lasts from 15 minutes to an hour and can repeat several times a day. Medication-overuse headache. Usually, this is a pressing, constant pain that often worsens after waking up. It's associated with taking headache medications for more than 15 days, especially when medications are taken continuously in small dosages to prevent a common headache. How to cope with headaches. Please note that this video isn't meant to replace a doctor's consultation. To receive proper treatment, we recommend that you visit a medical specialist. Migraine relief. An analgesic or non-steroidal anti-inflammatory drug. It's important to take it as soon as you feel the symptoms. This is the main way to deal with migraines. The rest is supplementary. A wet, cold towel, a bag of frozen peas, or a cool shower. Keep the compress on your forehead for 15 minutes, then take a break for 15 minutes. Aromatherapy. Essential oils such as peppermint, lavender, lemon, and rosemary can help reduce cramping and nausea. You can gently massage your temples or take a lukewarm bath with oil droplets. Relief for tension headaches. A warm compress, heating pad, or warm shower. This will expand blood vessels and relieve muscle spasms. Pay attention to the temperature so you don't get burned. Massage. Self-massaging the neck and temples for a few minutes can help relieve tension headaches. You can use lavender and peppermint essential oils during the massage. Walk or rest. Change the environment and remove annoying factors. The headache can get better if you get some fresh air or relax and get some rest. Cluster headache relief. Unfortunately, conventional analgesics won't help in this case. They act too slowly, and the headache will develop before the medication can take effect. For correct and successful therapy, you need medical advice and a holistic approach. Keep watching this video to learn how to prevent headaches naturally. Relief of medication-overuse headache. Stop overusing the headache drug. Don't take it as a preventive measure. Take a non-steroidal anti-inflammatory drug or NSAID to stop the headache, and visit your doctor to receive a transitional medication. Remember that it's advisable to take NSAIDs no more than 6 days a month, and combined analgesics no more than 4 days a month. For any treatment corrections, see your doctor. 7 effective tips to help prevent any kind of headache. Practice relaxation. You'll benefit from stretching, yoga, meditation, or progressive muscle relaxation. You can even ask your doctor about physical therapy to relieve muscle spasms in your neck. Get rest. Close the blinds, lie down, and relax for 10 minutes when you feel like a headache is coming. Don't wait for it to get worse. Stay out of the sun. The risk of severe headache increases by 7.5% when the temperature rises by 5 degrees. Carry water with you and stay in the shade. Drink water. Headaches are one of the first signs of dehydration. Drink fluids throughout the day to stay hydrated. Get enough sleep. Excess or lack of sleep triggers headaches. Therefore, good sleep reduces the risk of attacks. Try to sleep 7 to 9 hours a day. Limit alcohol intake. Alcohol dilates blood vessels, which can cause headaches. Alcohol also causes fluid loss, which leads to dehydration and can cause or worsen headaches. Get massages. Headaches are a neurological disorder. A kinesesiologist or professional massage therapist might find muscle tension and demonstrate exercises to improve your condition. Does my head hurt from high blood pressure? We talked about ways to deal with hypertension in our last video. You can follow the link and watch it. Now, let's get to the question. Does your head hurt due to hypertension? Some people think that if they have a headache, it's caused by high blood pressure. Well, that can be true only when systolic pressure exceeds 180 millimeters of mercury, or when diastolic pressure exceeds 120 millimeters of mercury. Most often, headaches act as a stress factor that provokes the rise of blood pressure. In fact, any pain can increase blood pressure by up to 30 millimeters of mercury. The pressure will drop on its own when the headache goes away. If your blood pressure is below 180 over 120 but still higher than normal and your head hurts, you need to look for another cause. Most often it will be a migraine or tension headache. High blood pressure is often called the silent killer. It can have no obvious symptoms to indicate that something is wrong. Does my head hurt from low blood pressure? While many people with low blood pressure may not experience symptoms, other people experience headaches, among other things. There is no specific characteristic of the pain. It may be aching, pounding, throbbing, stabbing, or pressure-like. Low blood pressure headaches are often caused by other symptoms or causes. You can follow the link in the corner and learn more about hypotension from our last video. The causes of low blood pressure headaches can vary from person to person. Some medications may cause the body to lose more liquid, leading to a decrease in blood volume, low blood pressure, and sometimes a headache. Some people may become temporarily dizzy or see stars, which may trigger a headache. A change in posture may also trigger a headache due to low blood pressure. To summarize, your head may hurt with low blood pressure, but this is not always a symptom. Anyone concerned about their symptoms should see a doctor for a full diagnosis and treatment plan, because low blood pressure could relate to an underlying condition. Hopefully, we've covered this topic properly. If not, we're looking forward to your comments. Thank you for watching this video. We encourage you to watch our other videos about health and subscribe to our social media. All links are in the description box below. We wish you good health. Take care.